I'm Dr. Josh Honig, GP at the Eramosa Family Medical Centre in my 20th year here, and just talking about some of the procedures I do in office, including the Mirena intrauterine contraceptive. It's a plastic contraceptive device that is inserted into the uterus of women, both for long-standing, long-acting contraception as well as to control heavy bleeding. It's probably the commonest age group I would insert these into would be women in their mid to late 40s before the menopause, where contraception might be needed, but irregular heavy bleeding is a problem as well. I discuss in detail how the Mirena is inserted before I put it in, but effectively it's like having a pap smear that takes an extra minute or two and is maybe marginally more uncomfortable. The practice provides printed information before it's inserted, where I encourage women to take a couple of anti-inflammatories like Nurofen or Nurofen Plus maybe an hour or so beforehand, just to relax the uterus a bit. Mirena is then picked up from the chemist as a prescription, and it comes in a large box that is incredibly intimidating because the device looks something similar to this. This is a demo model. The length of this tubing is the introducer. The Mirena itself is this very small plastic device where the green is a small hormone impregnated segment that sits inside the uterus and dries up the lining. These little red plastic wings basically just sit effectively at the top of the uterus where the fallopian tube is. And there's a little bit of a wire that comes out that sits inside the vagina coming out of the cervix, a bit like fishing line. So nothing to worry about when you see the size of the box, because the actual device fully extended is only 2 centimeters in size. All things being well, they can stay in for up to 5 years, offer very reliable contraception. The whole procedure takes effectively 5 minutes to put in, very well tolerated, but more details are provided by the doctor referring you to me, which is often another GP within this practice. And the out-of-pocket cost is around the $100 mark, making it a pretty effective, affordable form of contraception for 5 years. Suitable for women who've had children, even older teenage women who choose this form of contraception. In most cases, whether you've had a cesarean or a vaginal delivery shouldn't make much difference either.